Right, fastest 15 minutes in social media, fastest 15 minutes on the internet. My name is Judson Powell. Now, I want to talk to you a little bit about opening up the country. And because we have such poor leadership, Trump, because we, no, but seriously, but because we have such poor leadership, we don't really have any common sense people out there. And we have like two things, and we don't have to me, we have like either it's don't open because everybody's gonna die, or it's like we're gonna open because we need the money, and then there's like no common sense in between. That's my assessment of the thing. All right, so all the people over here on the don't open up because we're gonna die, that's nonsense. Okay, and the reason why it's nonsense is because if you're reasonably healthy and you don't have any of those pre-existing conditions or anything like that, and you take precautions and everything like that, 9 times out of 10 you're going to be okay. If you're healthy and your immune system is healthy, 9 times out of 10 you're going to be okay. And just continue to social distance and wear your mask, but if you feel you're in a situation like that. And of course, if you're sick, if you're symptomatic, if you're showing any symptoms or you're sick in any way, shape, form, or fashion, then quarantine. Simple. All right, not that difficult, not really that hard, and really simple. And we have to keep on going with the thing about the same thing that the doctor said, that this is a very easy virus to kill and get away with, and there is an over 80% recovery rate. So most people that get it, they recover. Most people are not dying, and most of the people that have died are elderly. There's some numbers stating. I mean, I don't know what to believe. I don't know what research to believe, but there are numbers stating that there's a lot of black people dying. There's numbers saying that there's a lot of elderly people dying. There's numbers, but most of these people that are dying, they have pre-existing conditions. So just be precautious. Now, if you live in New York or New York City, those are places that I don't think that they probably should open up right now. Why? Because there's just too many cases and there's too much of the stuff rolling around. But and the other thing is, as it starts getting warmer outside, the warmer that it gets, the least likely it is that the virus will spread. Okay, so that's how come, a lot of people say, well, as soon as it gets to be summertime, we'll be okay. All right. Now, on the opposite hand of the people that are like, yeah, we need to open up because we need to make money, I think we need to stop shaming those people. I mean, and basically, and the other thing is it's our life. You have, it's your life to live or to die if you want to. That's up to you. And now here's the problem with all of that. All right, they are right. If we don't open up this country soon and start doing business, we are all going to be broke. Everybody that's not a multi-millionaire is going to be broke. Is going to have your home repossessed, your cars repossessed, all that, because they're not gonna forbear all this stuff forever. Okay, unless there's some miracle legislation or something like that, and those couple of, even if they give us $1,000, $2,000 for a couple of months or whatever, that is not going to sustain or maintain anything because it's not enough money. All right, so in a way, those people are correct too. So there has to be some medium ground. And the other thing is, once again, going back to the doctors, it's an endemic virus. They don't want you to understand that. A vaccine is not going to, and that's the other thing. People think that they're going to get a vaccine. There has not been enough time to do clinical trials on a vaccine in order to get a vaccine out there that we know that will work. It's impossible. You're not going to get and the vaccines that they had or whatever, now, come to find out they were basically for other drugs. But viruses and this type of viral virus, from what I understand, the only way that you can get rid of it is if your body fights it off. All right. that your immune system and the antibodies in your body fight it off. If they don't fight it off, you die. So that's why we kept on talking about high doses of vitamin C, high doses of zinc, high dose, vitamin D from the sunlight, all those different kinds of things, which is one reason why they opened the beaches back up. And in fact, I understand New Jersey and New York and Connecticut and all those beaches are going to be open this weekend. So I'm just saying, you've got, you can't, and the other thing is quarantine. Let's be clear. Quarantine, there's over 90,000 deaths now. When quarantine started, there were like a handful of deaths. All right? There was less than 1,000. Now there's 90,000. So quarantine has not worked. It hasn't worked. Our numbers have been soaring up. And we didn't go because we're so prideful. We didn't go and ask China what they did. We didn't go and ask Iran what they did. We didn't go and ask Japan what they did. All of the places, the UK, what did they do? All the places that had Italy, what did they do? All the places that had very high death rates, we didn't ask them what was their procedure. How did they break out? Because none of them are in quarantine anymore. They're out. So what are we doing? That's my point. We can't stay like, and the other thing is, it's not working. Staying in the house ain't working because more people are being infected. The curve has not decreased, and what it was supposed to do, and from what I understand, the only thing that the quarantine was supposed to do was give the medical profession time to deal with the amount of people, the potential amount of people that could become infected. The other problem we have, speaking of infections, is that we don't have real numbers. These numbers are fake. They're not real. All right. And the reason why they're not real is because, once again, and we get, people come in and it, but if you are asymptomatic, you can still test positive. So you could get 1,000 people to test positive, but nobody has a symptom. So it's not realistic to say out there, oh, this place has 1,000 new cases. Great, but how many people died, or how many people have symptoms? That's the problem. We have, like here in Arizona, okay, we had like a week where we had like I think it was like 500 people tested positive, but come to find out, like less than 1% of them were symptomatic. So what do you do? And just because people are tested positive, if they don't have any symptoms, then it's like anything else. You got to keep rocking, And I think, and one of the doctors, because I don't use the doctors' names because people say that you got a conspiracy theory or that you're in love with this doctor or whatever, blah, 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 blah. But the bottom line is that there are other people who study viruses besides Dr. Fauci. There's other doctors out here that have been studying viruses and know stuff about viruses. And the other thing is, I don't trust Fauci because he works for Trump. I don't trust anybody that works for Trump. If you will work for Trump, then you have the same integrity. It's just like if you vote for Trump, you are a racist and a white supremacist and a white nationalist. Because what? And that's what you are. So you're pushing their agenda. You're not giving independent advice. And they say exactly what they are told to say. That's why I don't listen. And that's why I think all of this is BS. And the other thing is, I think also New York proved what? As soon as they put these different mask violations or curfew violations or whatever, who did they round up? The majority of the people that they rounded up were who? They were black. Let's be honest. And all of these things, so now, and that they want to make it seem like we are getting more cases or we're dying and this, that, the other thing. Why? To make people afraid of us. And I don't believe, that's why I don't believe any of these numbers. And when at first, it took months for them to even start asking about race. They didn't even keep records of race. And so I want to know, how all of a sudden do you know everybody that's black, white, Latino, whatever, and what their status is. And we also know that black people don't have, a lot of black people, in fact, at the beginning, a lot of people lost their health insurance. A lot of people don't have health insurance. Okay, people that don't have health insurance, what happens? They get turned away. And we have numerous reports of people being turned away. I mean, numerous reports. And then to add on top of that, the incorrect treatment protocol, because the whole ventilator thing, scam. Because what, they were going to give this big contract to General Motors and Ford in order to make ventilators. We tried to get, and then we got all these ventilators from all these other, and so the treatment protocol was ventilators. And we know, people that got put on ventilators died. So it ain't the virus, it's the way, like I said, the quarantine was supposed to give the doctors time in order to get together the treatment protocol, because they didn't want to be overwhelmed with people. But after the treatment protocol was supposed to be established, the correct treatment protocol was supposed to be established, we were supposed to then be able to handle the pandemic. We were supposed to be able to handle the large numbers. And there are places right now, there's not a great demand. Like I said, New York City, is a different story. It's a different animal. So we can't judge things by what's going on in New York or in that little northeastern corridor right there, and the other thing is, and that is also the fault of the leadership, because instead of quarantining people coming in the country, they just let people in and let them go. The other thing is, and back to the racial parts of this, we know that black people are going to have what? More pre-existing conditions, which was funny that was, once again, thinking. I just want y'all to be independent thinkers. Once again, that was the hallmark of Obamacare. And funny how this man-made virus is attacking people with pre-existing conditions. I don't know. But I'm a conspiracy, but don't take my word for it. I'm a conspiracy theorist. So, that's what I keep getting called or whatever. But after a while, once you start getting report after report, it's not a theory. These are facts. There are people that have been turned away. There have been black people that have been turned away. They are not, and the other thing is, they're overinflating the African American numbers. How? And we have reports of that. Reporters have gone out and have discovered that they have put on death certificates that the person died from the coronavirus, when really the coronavirus had nothing to do with their death. So every single African American death, and then we have the 3 nurses who sat up there, and said, look, they're not treating these people right. They're not trying to save them. They're letting them die. We have reports of that. Okay? And, but these are not conspiracies. These are actual people stepping forward, and, I even had a friend of mine say, well, how do you know they're working out? If enough people step forward and say something, 9 times out of 10, it's probably true. So we got to go out and live life. We're social beings. We're not equipped to be quarantined. We're not zoo animals. We're like, right now, we're caged like animals in zoo, which is also bad for your health. It's bad for your, we have people committing suicide. These are things that they're not telling you. We have people committing suicide. We have nurses and doctors committing suicide because of the wrong treatments and the wrong protocols are being used. Now, it's not a conspiracy. We have to get out and we have to live, and if you're reasonably healthy and you take precautions, you're going to be all right. And there's no way that, if they release us for quarantine now or a year from now, people will still die from the coronavirus. They will still die from this strain of the coronavirus because it's endemic. It's always been here and it's always going to be here. Once it's in the blood, it's there. nothing you can do. And people are carriers. Anyway, fastest 15 minutes is up. Open this puppy up and let's have some fun. Bye-bye. Look, hit the subscribe button, hit the like button, I don't know, just hit all the buttons. Anyway, hit some buttons for me. I love y'all. I'm not telling y'all nothing that's going to get you hurt.